The WA Disability Health Network has developed a framework to help the health system improve health for people with disabilities. 1 in 5 Western Australians has a disability. 1 in 3 is impacted by disability, either because they live with a disability or care for someone with a disability. The social model of disability has been adopted across the world as the best way to think about disability. In this model, disability is caused by how society thinks and acts rather than a person's impairment. Some disability is very easy to see. Other disabilities are not so easy to see, like hearing loss or intellectual disability. Not all impairments lead to disability. Many people experience barriers which make it hard to live everyday life. A physical barrier might be steps at the front of a building, difficult for a wheelchair user. An environment barrier is not being able to hear in the cinema because there's no access to sound, difficult for someone with hearing loss. A person might find it hard to be part of social activities because they don't have the social skills to join in, and people don't make them feel included or welcome. Some people find it hard to communicate in a way others can understand. Attitudinal barriers occur when we make assumptions about people with disability without talking to them. People can have preconceived ideas about a person's ability without taking time to get to know them and learn what they are capable of. The statistics for health disparities for people with disabilities are overwhelming. People with disability have much poorer health than other people. People with disability are 3 times more likely to have 3 or more chronic health conditions like diabetes, heart disease or asthma. 6 times more likely to have mental health problems. 8 times more likely to experience childhood onset of mental illness. They are more likely to be obese, smoke, and not participate in exercise. They are 10 times more likely to visit a GP, 3.5 times more likely to consult a specialist, and 5 times more likely to consult a specialist in combination with other health professionals. Over the past 5 years, the health of people with disability has got worse. People caring for people with disability also have poorer health compared to others. Everyone in Western Australia has the right to good health care, which meets their needs as an individual, no matter what their situation. The WA health system knows this is important for people with disability. It has developed a framework that people can use to make their services better so people with disability have better health. Better services include having access to the right services, making sure those services are meeting individuals' needs, and coordinating care amongst health workers. We've talked to people with disability, their families, carers and staff to develop the framework. They have told us that it is important to them that health workers understand more about people with a disability and make people with a disability feel welcome when they visit. Health services need to be inclusive. To make sure people with disability get the care they need, you should take the time to ensure everyone understands the different needs of people with disability, include people with disability, their families and carers in decision-making about their care, and support people with disability to be as healthy as they can be. It is everyone's job to work together to help people with disability live a healthier life. By working together, we also make a better health system for everyone. Inclusive health services should be flexible, be respectful, work together with people with disability and their families and carers, and always try to continually improve care. The WA Disability Health Framework can help you improve healthcare of people with a disability. Disability doesn't discriminate. Disability matters to all of us.